Hi, I'm Nick Klensky reporting for a Daily Bulletin. I'm talking to Dr. Alyssa Watanabe from USC Keck School of Medicine in Los Angeles, along with Dr. Matthew Nudi, a cardiologist at Penn State. Both are sharing key learnings from the RSNA 2025 session, Breast Arterial Calcification Progression on Mammograms Predicts Risk of Major Adverse Cardiovascular Events. Thanks for joining me today. Your study shows that breast arterial calcification, or BAC, on mammograms can predict major cardiovascular events. What motivated you to explore BAC as a potential marker for heart health?
I think the motivation behind this study is that women face disparities when it comes to cardiovascular disease compared to men. So, women are more likely to be diagnosed at later stages of cardiovascular disease. Following a heart attack, women have a worse prognosis compared to men. And also, women are less likely to get guideline directed medical therapy for cardiovascular disease. Part of this disparity might be due to inadequate cardiovascular risk assessment tools that we have. So we were interested in looking at other ways that we can improve cardiovascular risk assessment in women. And breast arterial calcification on mammogram seemed like an untapped resource where we could add some prediction to the development of cardiovascular disease and hopefully eventually improve outcomes.
Great. And you found that rapid progression of BAC, especially in women under 65, is linked to dramatically higher cardiovascular risk. How could these findings influence how radiologists report BAC or how clinicians use this information in patient care?
Well, currently, breast arterial calcifications are underreported by most radiologists. The new BI-RADS manual that came out just recently now acknowledges that BAC is associated with cardiovascular disease. So we recommend that BAC presence be reported on all screening mammograms as an opportunistic way to flag women that are at highest risk. Also, for women that have BAC present, following them with surveillance for BAC progression is important because that further increases their risk for adverse cardiovascular events.
And I'll just add what information we could gain from this information. We could use this information to increase the preventive therapies that women receive for cardiovascular disease. It potentially could be used as a risk enhancing factor to re-stratify patients and their cardiovascular risk.
And this study leveraged AI to quantify BAC scores over time. How do you see AI and sequential mammogram analysis shaping the future of cardiovascular risk assessment in women?
I think AI may allow for breast arterial calcification detection and its severity and also its progression to be more scalable, to be more easily available to clinicians. I think having this information for clinicians who assess cardiovascular risk, like primary care doctors or cardiologists, could be useful.
Thanks for your time today. For more information about the study, look for this RSNA 2025 session on demand at rsna.org/meetingcentral. And as always, you can find more radiology news at rsna.org/bulletin.